ever had a severe toothache and you were told you needed a root canal and you had no idea what they were talking about? Today, we are going to talk about what is a root canal and how it's done. And before I keep going, make sure you subscribe, like, and share this very important episode. And for people who are watching us on YouTube, we are also on Spotify, Apple Podcasts, iHeartRadio, Audible as the Wonder Tooth Podcast. Make sure you put code 92 to get complimentary consultation if you ever need some dental work to be done. And we are so honored today to have Dr. Liz, Dr. Nadia Liz. She is an expert in endodontics. She is an endodontist, which she's going to explain to us what is an endodontist and how can a general dentist becomes an endodontist. How are you, Dr. Liz? How are you today?
Good. How are you, Dr. Saad? I'm doing very well. Hello, everyone.
We are very happy to have you today because a lot of patients, they don't know what is a root canal or an endodontic treatment, and they get scared because, other people, they hear from other stories. Oh my God, what is a root canal? I'm so scared. I'm so nervous. So first of all, can you introduce yourself? Tell us a little bit about yourself.
Yes. Hi. I've been a dentist and endodontist for almost 15 years. I went to Temple Dental School and I worked for one of the big practices in South Jersey. Currently, I have my own practice in Hamilton, near Trenton, New Jersey. And I've been very lucky because people learning more and more that endodontics is actually a field that's needed in dentistry. And um, general dentists also send complicated cases to endodontists. So to become endodontist, you go to dental school for 4 years, and then general.
That's after general dentistry.
Exactly. 4 years of general dentistry in school, and then residency lasts about 2 to 3 years. So it depends on the program. So it's a quite extensive, learning process to handle everything. I have to say, endodontics helping now patients with fears because dentistry is changing in general. We have this innate and primeval fear of dentistry because really, like Dr. Saad said, as you mentioned, we hear stories and Google doesn't help. Um, but it's really quite comfortable procedure nowadays as far as you go to an expert or even general dentist who has all the tools and training could do the work.
And what made you want to become an endodontist?
I myself had very uncomfortable experiences in my childhood. Even though my parents were physicians, nobody knew anything about teeth somehow, unfortunately. And growing up in Eastern Europe, anesthesia was kind of scarce, unfortunately. Currently, it's changing. It's 21st century. It's more comfortable and even enjoyable procedure, I would say. Usually, it takes under an hour. If
Mm-hmm.
root canal, of course, a molar. Sometimes if it's infected tooth, a couple of appointments, maybe sometimes 2 or 3. If it's draining, people wait too long. Unfortunately, then you hear scary stories that they had a bad experience. But usually if a dentist or endodontist has imaging and all the tools and magnification device like microscope, it would be more comfortable procedure and quick, more efficient.
That's great. So you mentioned anesthesia. Is it local anesthesia or general? Because some patients, they don't know.
Right. It is usually local anesthesia. It's just we know how to numb if there's a we call hot tooth, and the tooth is very painful when people wait too long or they have a cavity for years, and then it becomes infected. Sometimes it's very hard to numb, and those are the stories you probably all heard. But there are ways around it. We can numb around the ligament of the tooth, and in addition to a main nerve. So just many options to make you comfortable.
And then when they are getting the root canal, so it doesn't hurt, right?
Exactly. That's the goal, of course.
Yes. And is it possible to offer like some laughing gas or some IV sedation for people who are extremely, extremely nervous?
There are options like that. Yes, there are endodontists that provide general anesthesia or are under twilight IV sedation. I don't do that myself, but there are options if somebody had very uncomfortable experience or they have a fear from childhood. So unfortunately, some people do need that. There are also options for oral sedations to make you comfortable. To give something to relax, like maybe a couple of pills of Valium or one pill before nighttime and 1 hour before procedure, make you very much, it's all, unfortunately, it's all in our head. So makes the patient more comfortable and relaxed, and then everything will go easy.
True. And if you would take oral sedation, obviously you cannot make proper decisions, so you have to have somebody who has to drive you.
Exactly. So there should be consultation first, and then you make sure that the patient has a driver and drive back home, of course.
Yeah. So what are the symptoms of like how can anybody like, okay, I think I need a root canal. What are the symptoms?
Um, Usually, if it's acute symptoms, sometimes patients get a deep filling, which is done nicely, but sometimes, unfortunately, the nerve becomes inflamed if it's near the nerve or the cavity was also kind of deep. Then the patients develop the cold sensitivity. There's such thing as postoperative sensitivity right after procedure. 2 or 3 weeks of a little bit of discomfort, mild discomfort is normal, and then the nerve settles down. If it doesn't, the cold sensitivity progresses, even room temperature bothers the tooth. And unfortunately, the tooth becomes very uncomfortable and painful. It's throbbing, such symptoms as throbbing. You're watching TV, spontaneous pain. You don't have to chew, but even chewing would induce that uncomfortable sensation, discomfort. So then, unfortunately, you do need root canal, but some people live with cavities for years, and then it becomes abscess, the nerve eventually dying off. And with abscess, again, it's a little bit harder to numb. There are ways around it, but we don't recommend waiting. As soon as you have discomfort, it's unfortunately downhill. The nerve just not gonna recover. Advil will take you to comfortable level, but only for a couple weeks, and then it will come back again.
Mhm. So you would suggest once a patient has a cavity, it needs to be taken care of like right away.
Of course, because it only progresses.
Yeah. And you also mentioned a hot tooth. What is that, a hot tooth?
Hard tooth is we see once in a while again when patients try to delay the treatment, and even doing a filling in timely manner would help, but when they wait over a period of weeks and months, it will progress, and the nerve, it's called nerve sprouting. It's basically a phenomenon when the nerve just becomes hypersensitive, and even though the patients are very comfortable and numb, we cannot reproduce any sensation. However, when you start drilling the tooth, it's very uncomfortable, and the tooth itself we call hard tooth because it cannot get numb because of this inflammation that's been happening for over weeks and months. Again, it happens when patients wait too long, even just with simple filling, which could take care of it and prevent root canal, but eventually now, unfortunately, it's too late, and they need root canal, which is harder to numb. Again, there are ways to deal with it to make you comfortable. However, we don't recommend waiting.
Yes. And can you explain now to whoever is watching us on YouTube or listening to us on the podcast, how is a root canal done? Like as an endodontist, what exactly like the steps? If somebody is walking now into your office, what are the steps?
Right. Root canal is really a removal of a vital tissue in a tooth. So if you imagine a tooth and that kind of lines we see inside, the roots have basically canals, and canals contain nerve and blood vessels. So when the tooth becomes infected or inflamed, that starts dying off and becomes necrotic tissue, which is also why it is important to do root canal, because some patients say, okay, the tooth is dead, why do we need root canal? Just leave it alone, because it's necrotic tissue that harbors bacteria and becomes, unfortunately, pus and abscess over time. So when we do root canal, it's basically just like general dentist drills out the cavity or deeper filling. We would go further down into this canal area or pulp initially, and then pulp splits into roots, and roots contain the vital tissue, which we remove, clean it out, and we use a special irrigation material and mechanical debridement to remove that dead tissue and disinfect the tooth, clean out canal walls. If it's infected, we put medication. Infected meaning, again, it became an abscess tooth. We would put medicament inside the canals for 2-3 weeks or so, and seal the canals once it's all settled down and patient is comfortable. We would seal canals with gutta percha, which is thermoplastic material. It's naturally derived from, it's a resin naturally derived from Malaysian tree. And basically, it's, in that sense, I would say it's a holistic material because it's natural. It's placed in canals and seals it. We use kind of warm instrument to heat everything to disperse it and seal it nicely against canal walls. We don't want to miss anything. And we use also special cement. So to look at it, it's like you have a pencil and we just remove the lead from the pencil. So we maintain the roots. The roots are not removed. You keep the tooth. The patient has the tooth that functions and looks like a tooth. However, there's no more necrotic and diseased tissue. Then it's sealed by temporary filling, usually in endodontics, and patient returns to the general dentist to proceed with the crown. Which is also a very important step because, as you probably heard from some friends of yours, they said root canals never work for me. I had bad experience. I'd rather have the tooth out. That usually happens, when they delayed placing a crown or sealing the tooth correctly. As you know, it's very important to return to the doctor, to your general dentist, to take care of that step. Look at it as if it's a house, you and the dentist clean your house, rebuild everything, foundation and flooring, hardwood floors, beautiful kitchen, but then you didn't put a nice roof over your home. And so the roof is your crown. So it's very important. Otherwise, everything gets,
That's a great explanation. I love it.
unfortunately will become infected again and patients lose teeth. We get busy with life, but it's very important within 1 month to reach the doctor.
Yeah. Now, this is a great explanation. Some of the patients, they don't understand why do we have to put that little ring around the tooth and that little rubber thing on their mouth, and is it important to do it or it's not important to do it, and how can you identify if whoever is doing your root canal is doing a good job or not?
Right, that's a great question. I think for first time patients having root canal, they sometimes don't know. Again, some people Google it and they know on YouTube. They place that ring, which is called rubber dam, and a clamp goes around the tooth. So we basically isolate the tooth, and we're working only on a tooth. So it's a protective feature for the sake of a patient, so nothing goes in the mouth. It also, they don't need to worry, where is my tongue when we're drilling, which is very good option. A lot of people like it. But really, it's a standard of care in endodontics, or anybody who does root canal, even if general dentist undertakes root canal treatment, preferably it is needed to be used. Also for biological reasons, because saliva goes in the canal. Saliva also contains bacteria, So on biological level, it's all about bugs, right? So
Mhm.
viruses, bacteria, everything contains, even in saliva, and we don't want that going in the tooth. Also, we use irrigation. We don't want patient tasting anything. So it's a protective feature as well as just for the comfort of the procedure for both patient and a doctor.
It's a very important step, guys. So if you go to any dentist, any general dentist or endodontist or anybody who says, I'm going to do a root canal, and they do not put that little clamp, that little ring on your tooth, and they put a rubber thing on your mouth, walk
Right.
out, walk away, because they are not doing a good job, and this is a very big liability. She mentions something can go in your mouth. So when we're doing a root canal, we're using very tiny little instruments. If there is nothing rubbery basically isolating that tooth, that something can get into your throat, and imagine it can go into the wrong pipe, and we have a very big emergency room. We're looking at the emergency room surgery. So root canal, it doesn't hurt, but we have to put that rubbery thing to protect you, basically. This is really, and then with the stuff that we're using, she said, she mentioned irrigation. In order to get, make sure that the canal is very clean, we have to use certain chemicals to, so you cannot ingest that. This is not to be ingested. It's not like a, soda, basically. It's a pretty strong, aggressive chemicals that we use to clean the inside to make sure it's completely clean, free of any bacteria.
That's correct. Yes.
So you guys, now this is a very important step. That little rubber dam and that little clamp, this is can really, it can tell you if you're doing, like, if whoever the dentist is doing a good job or not. Because I've heard of some patients, I don't want to get that, and the dentist would be, it's fine, you don't have to. You have to. You have
No,
to.
I have quite a lot of patients still saying, my dentist did it without it. Why do we need to use it? And I said, well, that's why you're here now. It's infected again. So unfortunately, we have to redo root canal. But yes, some patients also, I mean, it's takes couple of seconds, to get used to it. They don't like this feeling of something closing up. But there are ways to also make patient comfortable and move it a little bit to help them breathe. Some
Mm-hmm.
mouth breathers. So if you close the mouth, they feel like they suffocating. But we can move it and adjust it to make you comfortable.
You can move it a little bit so at least the side is open. Yeah.
That.
Yeah.
Hmm.
Yeah. Very good. And a very important question. Is it really worth to try to save a tooth doing a root canal and a cap, or just simply go ahead and get it extracted?
I believe. I believe we should maintain our natural teeth, natural dentition for as long as we can, especially with advances in dentistry. Even if it's a stump of a tooth, there's nothing coming out of a gum, there are still ways to maintain it if possible. If there's enough above the bone and it's a chewing molar, I would recommend trying to save the tooth. At least you have that extra step and a trump card in your pocket just in case. Next step will be implants sometime, hopefully in 10-15 years. But
Mhm.
implants also are a little bit more take longer to do and a little bit more expensive option, unfortunately. So it's a good thing to try to maintain your tooth. And then when it's really, we cannot help it sometimes, if there's nothing left or the bone is not good, it's just like foundation around the roots, foundation around your house is not good, then we would advise it to be removed. But for as long as possible, please keep your teeth.
Mhm. Nothing really, I keep telling patients, nothing is like what nature made. Nothing.
Mm-hmm.
Anything that's man-made, and I do implants, nothing that's man-made is equal to what's actually you were born with it. So a tooth has complete different sensation than an implant. You have sensation in a tooth. You can tell if it hurts or if you're putting pressure with the implant. You don't have that.
Mm-hmm.
Implant, it's a very good option, but this is the very last resort, the absolute very last resort. If you can save anything in your mouth, please do. Don't let extraction be your first guard, because it doesn't help. Your whole mouth actually changes. Your whole, like for the ladies out there, if you pull molars in the back, your whole, your face is gonna start to sink, and you're gonna look at yourself and you're like, what's happening to me? Why am I seeing wrinkles here? Why my face looks completely collapsed, basically.
The sensation is different, yes,
Yeah,
and it's important.
yeah. And you mentioned also that there are some magnification and you can get a root canal done like after less than an hour, correct?
Depends on the doctor, but yes, less complicated cases, pretty much yes. All in all, I set appointment for 1 hour, and then numbing, proper numbing. If it's a lower molar, takes longer time, 15 minutes. I let it cook really. The more we wait, the more comfortable patient is, the quicker and more efficient will be, and it's easier for the patient. So yes, it's changing. Dentistry in generally getting better. As you probably know, our first dentist were blacksmiths traveling from town to town, and okay, let's fix your horse's hooves and maybe your teeth. So that was scary time. It's really changing. So um plus anesthesia, great option. It's not whiskey anymore. So so
And
it's
you, of course, you have to select a really good endodontist like Dr. Liz.
yes, we are shooting for that, to please
Yes.
people and make everybody comfortable.
It was an incredible episode, and I'm gonna put Dr. Liz contacts and website in the show notes. And she is an incredible endodontist. I know her in person, and she is on the East Coast, so I know people travel to see her from all over New Jersey, from Pennsylvania, and some of them they come from New York. I know that. So, Dr. Liz, it was a pleasure, and we are going to have more episodes coming up to talk about more in endodontics, the advances in endodontics, and how now a root canal is really very easy to be done, and why it's important to get it done. And most importantly, there is a whole lot of claims and myths that are going around. Root canal, don't get a root canal, get your tooth out, oh, it's gonna make you sick. We're gonna talk all about that in the next episode. So stay tuned. And thank you so much, Dr. Liz. I really appreciate it. It was incredible.
Thank you for having me, Dr. Saad. It's a pleasure. Thank you, everyone. Have a good day.
So, with this, make sure you guys subscribe, like, and share this important episodes with any of your friends or family who are thinking about getting a root canal or even thinking about getting a tooth extracted. Tell them why they shouldn't be doing this. And make sure you take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.